febrile neutropenia patient. Febrile neutropenia patient. We want to know if we should, admit or give oral antibiotics. And the person was given chemotherapy and they come to you after chemotherapy with fever and neutropenia. So fever of greater than 100 or 38.3 and absolute neutrophil count less than 500. So this patient is termed febrile neutropenia. Now we need to know if we have to admit this patient or treat this patient on outpatient basis. So according to the guidelines, we give this patient an MASCC score. So the MASCC score will be I have a mnemonic for that. M means the malignancy type, if it is solid or hematological. And the goal, always remember in MASCC, the higher the score, the maximum score is 26. Score greater than 20 means the patient is low risk, and score less than 21 means the patient is high risk, and for low risk, they are eligible for oral antibiotics. In high risk will be IV antibiotics and immediate action. So if the score is less than 21, then this patient is eligible for inpatient admission. And how do you calculate the score? You see the malignancy type. If it's solid, then you give a 4, score of 4. If it's hematological, you don't give a score of 4. You don't give any points. But if the age is less than 60, then you give a score of 2. Okay. And if the site is in OPD or IPD, if the fever was first experienced in outpatient status, then you give 3. If the fever is an IPD, obviously it's already IPD, so you don't give a score. If the patient has no COPD, you give a score of 4. And again, if the patient has dehydration, you don't give any score, but if there is no dehydration, you give a score of 3. And if the patient did not have any fungal infection, you give a score of 4. So you gradually keep adding on. If there are no symptoms, or if 0. So basically, you're trying, so every point you give in the MASCC is to push the patient outpatient. And you need at least 21 points to push the patient out of the hospital. So they have no symptoms, no hypertension, they already scored 10. If they have no COPD and it's a solid tumor and the age is less than 60, you get a score of 20. And if they have no dehydration, it's 23. And if it's an outpatient, you get a score of 26. It's a perfect score. So now we're calculating the score based on the MASCC index. And if they get a score of greater than 21, they're safe to be discharged. And so you're not liable for sending a febrile neutropenic patient home with oral antibiotics. But for example, if they are symptomatic, the score is 0 over here. And if they're very symptomatic or they're mildly symptomatic, it's 3. There's no no hypertension, no COPD, no dehydration. And so you keep adding up the score. So like for example, our patient has got hypertension, okay? And if there's hypertension rate is 0, so obviously, a perfect score is 26, and from 26, if you remove 5, the score is already 21. And then if the person has, like dehydration, then it automatically drops. So the best way to give a mass score would ideally start from 26 and then minus one thing down. So if you do it this way, then you're going to do better. It's much easier. So you start at MASCC of 26, okay? And then if they're symptomatic and they have severe symptoms, then you remove 5, so that is 21. And if the age is greater than 60, then we move to, so that's 19 and automatically need to admit them. Or if they have COPD, then it's 22, and then if they have dehydration, 390. So there you get the admission criteria.